Dr. Ann Doggett graduated from New York Chiropractic College and earned her master's degree in nutrition from the University of Bridgeport. In 1989, she returned to Quincy to found South Bay Chiropractic. In 2006, she expanded her office to whole body solutions at South Bay Chiropractic and added massage, acupuncture, and nutritional counseling to further assist her patients. Dr. Ann, you are so impressive. Welcome.
Thank you. It's a pleasure to be here.
We're so happy to have you. Dr. Ann, you are a chiropractor by trade, but yet you've added a nutritional element to your practice. We're all concerned. We want to know, what is the connection between the chiropractor and the nutrition, and how does this help your patients?
Well, we've known in chiropractic for years the premise is that any kind of stress on the body, physical, chemical, emotional, can create spinal issues, and that your spine is the protector of your nervous system. What the chiropractor does when they make a correction to the spine is to ensure good nervous system health. But if you leave the office and you encounter chemical stress or physical stress or emotional stress, you can only hold your correction so long. And in the area of chemical stress, we have the whole realm of nutrition and diet and toxicity and insufficiencies and the many things that are a part of the current American diet.
You talk about chemical stress. What is chemical stress?
Chemical stress can be a whole array of, too much of the wrong things, and that could be anything from a heavy metal that you've gotten through your drinking water to, outgassing from your carpet, formaldehyde, plastics, chlorine. Those are chemical stressors.
Chlorine. So someone can be swimming in a pool and they can be chemically stressed.
Certain physiologies are more susceptible to, so your body and how you were made and your genetics can make you more vulnerable to one stress than another chemically. But yes, chlorine is one of the ones that we see commonly.
And you talk about emotional stress. Now, to me, emotional stress is I start thinking about something and then I get all worked up. Is that the only kind of emotional stress? Or, how many different types is that? Are there a lot of types of emotional stress?
Oh, certainly. Stress in terms of the physiology, what your body does when you're under stress, is mediated by hormones. So little very powerful but very small substances that travel in the bloodstream. And the stress response was originally designed as a survival mechanism. So when the tiger was chasing the zebra through the forest or through the jungle,
right.
High amounts of certain hormones would be excreted or secreted into the bloodstream to help that animal survive the stress of the moment. And those hormones do certain things, like they shunt blood away from digestion, for instance. And they shunt blood toward the muscles, the larger muscles, to help the body move quickly away from the stress. And initially the whole stress response was something that would come and go within a matter of minutes. And what we have with American lifestyle is these continual, unrelenting stressors, whether it be some that we've mentioned so far, like chlorine or heavy metals or the chemicals in the environment, or your food choices, sugar, caffeine, alcohol, those chemical stressors.
Caffeine. I love caffeine. But I know, being a patient of yours, you told me caffeine is not good.
Well, there's a big story with, when we talk about caffeine, usually we're talking in relation to coffee. And coffee has many potential health hazards to it, because it's not just the caffeine. It's the fact that your beans are sprayed with pesticide and fungicide, and you're getting the residues of those chemicals in the body.
I never thought of it like that. So you're saying we're picking up other things besides just the buzz of the coffee.
Exactly.
Oh my goodness. It was like just a light bulb just went off in my head.
So you get chemicals, you get caffeine that stresses those glands that are very important for good health. And then you also get a shift in the acid-base balance. And we know that disease states love acid environments, and coffee is an acidic food. So in addition to your disease states, in an acid environment, your body will leach calcium from your teeth and from your gums and from your bone. And so that's part of the reason that we recommend the avoidance of coffee.
Oh my goodness, I'm going off on another tangent, but I have to stay focused here because my brain is just like saying acid foods. I have a lot of acid foods, and acid foods I know are really bad for you. But you just mentioned something. You said something about the blood being shunned away from the muscles. Now I know that, if I'm saying this correctly, as a chiropractor, you want to keep the blood moving because that has something to do with being fluid. Am I saying the right thing?
Well, there are two different issues. When we're under stress, the body will shunt blood away from the digestive system. So
Okay.
you'll see people with chronic digestive problems
Okay.
because they're chronically under stress. So that's one issue with blood. And yes, you want to keep the body moving and fluid, and you want to keep good blood supply to your joints and good blood supply to the body in general.
Okay.
So those are two separate topics.
All right. Well, we're going to talk about 4 different topics on this show: asthma, arthritis, fatigue, and infertility. And how do you determine what organs of the body need assistance, and how do you select which nutritional supplements will help?
We use a technique called nutrition response testing.
Okay.
And in nutrition response testing, we actually will utilize a couple of different concepts about the body. One is that every organ will have a series of blood vessels in the skin above the organ. So if have you been to the Science Museum exhibit of the body?
I'm going.
Body exhibit?
I'm going.
That will show you just how many blood vessels are close to the skin. And if we have an organ that's healthy, we should be able to put a little pressure on those blood vessels and not create any neurological stress. We use muscle testing as a way to assess, is there neurological stress? So an intact nerve system, you should be able to test a muscle, and you should be able to compress blood vessels and not affect that muscle.
Mm-hmm.
If there is a problem in the organ, not a diagnosable disease, but if, say, your thyroid, for instance, is not functioning at its best, the way that it could be, ultimately should be, and then if we compress that blood supply over that organ while we're testing a muscle, we're gonna create a change in the muscle test. And that's one of the ways that we narrow in to what system needs to be corrected.
One of the things that you do when you test people, and I find this very interesting, when I first came to see you, you ask the question, do you have any scars? And I was saying to myself, what does scars have to do with
Good health?
good health, being a chiropractor, nutritional well-being? What does, and
Well,
can you explain that?
I can explain it to the degree that we understand, which
Okay.
is that 80% of your sympathetic nerves are found in the skin. And anytime you disrupt a nerve fiber, you can create all types of imbalances in the body. For those who understand acupuncture and energy flow, you can directly affect the meridians or the energy systems that are external to the body that you can't see. You can also create imbalances in the nervous system itself, sympathetic, which are the nerves that help you respond to stress, and parasympathetic, which are the part of the nerve system that helps you rebuild and repair. So scars can function as capacitors, electrical, capacitors. They can send impulses where they don't belong and interfere with organ systems remote from the scar. And we see this most commonly in women who have had C-sections or women who have had episiotomy scars and then have trouble either losing weight or with postpartum depression or some of these other syndromes that actually reflect low thyroid function.
Okay, and you were going to mention the 5 body stressors.
In
One of those.
nutrition response testing,
Okay.
we recognize that there are 5 potential interference factors to nerve system function. And if they are there, you could get a fabulous chiropractic adjustment, you could have tremendous nutrition, be eating the right diet, doing all the right things, and you can still have a sick body. So
How so? If you're doing all the right things, how can your body be sick?
Well, there are things that you're not aware of. For
Such
instance, heavy metals, mercury amalgam fillings.
Oh, I had all my mercury taken out of my mouth. Was that a good idea?
Why'd you do that?
I did that because I was told by a doctor in Nevada, take them out because they can leak and it affects your body. It has some. It made sense. They had a very compelling argument, but if you ask me what did they say back when, I don't remember, but I remember going to my dentist and I said, I want all my fillings taken out. He says, you have lost your mind. And this was in the early 90s.
Well,
Did I do the right thing?
The American Dental Association does not advocate the removal of amalgam fillings. In fact, they believe that the fillings are stable. The mercury is stable inside the mouth, but what they neglect to consider is that when you apply heat and or pressure to these fillings, they can in fact outgas metals. And what we do know scientifically is that certain genetics can detoxify metals better, depending upon how your liver is set up and the enzymes that you have active in your liver. Okay. So not everybody needs to rush off to the dentist and consider this, but there are ways to test. And certainly if you have a health issue at all, it is something to consider. And mercury is not the only metal. The Nutrition Action Letter a couple of months ago had a big article about lead and lead in the water, and how if you are over 45 years old, you may have had exposure to lead before they implemented all these great changes. Oh, yeah. And lead gets stored in the bone. So as you age, particularly if you're female and you start to break down bone and lose density, you can be releasing lead into the system.
So what can be done about that if a woman collects all this lead in her bones? She's older. Can you do something to help her out? Can you find a nutritional supplement to offset, or keep, as you say, keep the body in balance?
What we do is we actually assess very specifically what's going to help that individual. We know certain things that can chelate or combine with metals and help remove them from the body. Things like cilantro, for instance, on an herbal medicine front can be very useful. Bladderwrack on the herbal medicine front. So you can test a person and see what their physiology really prefers in terms of supplements.
Okay. Is your exam on a patient based entirely on muscle testing, or do you have another way to test the body's ability to recover from challenges?
We have several additional tests that we do in our practice. The most useful to us is something called the heart rate variability test. And we use a monitor on the heart and we test the person in a resting state for 4 minutes, and then we have them stand up and we continue to monitor the heart rate. And from that we can check how readily the body adapts to the stress of standing. We can check how much reserve the body has in terms of hormone response to stress. We can check the internal aging, and we can look at the nervous system and the balance of the nervous system through this very objective test, which is being explored right now by the American Medical Society for its accuracy to be used in medicine. It's a wonderful tool that we use.
Is muscle testing an accurate science? Because I often wonder when I'm laying on your table and my arm goes up and you're testing to see if it locks. And I'm wondering, I don't quite understand how you are so successful at what you do to bring the whole body into balance, and what does the arm have to do with figuring out what nutritional supplements someone needs and how you can figure out what they need in the chiropractic area. I mean, you just have it all down. I mean, you have such an amazing practice. There's people constantly inundating your office and everybody's like sold on you because you're that good. So, tell us about, and if you want to test me to show, I mean, feel free.
Okay, well, let me just explain that it doesn't have to be the arm okay? And muscle testing is really a neurological test. So we're not testing how strong you are. We're testing, can the muscle actually lock into position, which is really a reflection of the nervous system and nerve system function. So I can ask you to hold your arm up, and I can apply the pressure to the arm, and you have a nice intact arm. If you had a problem with your heart and I had you just rub over the heart tissue, well, you could try it just so we can, you're gonna have to pretend now. So take your other hand and just place it right over the heart. That hand, yep, right over the heart. And now if you had trouble with that, just compressing those blood vessels is gonna distract your nervous system for a minute. Now pretend you're not holding, and the arm will go down. So that's, you know, it doesn't have to be the arm, it could be the leg, it could be any system that has an intact muscle that when we put a neurological challenge to it, you're unable to lock the muscle in position.
So you're saying that the body doesn't lie, that you get, it's a pretty accurate test.
When I first got introduced to this, I was pretty skeptical about it, and I have a science background.
Okay.
And you know, I have a formal study in nutrition. I was I got my master's degree in nutrition. I went to a very science-oriented chiropractic college, and I found it interesting, but I wasn't actually using a lot of it because I wasn't so sure about it. And I had a patient that I helped with neck pain. You know, she had chronic recurrent neck pain, and we had helped her. And about a year later, she came into my office and she said, "Dr. Ann, you have to help me. My daughter is sick with the fever. She's been sick for 10 days. The pediatrician told me she has the flu. It was January, and a lot of kids, in fact, had the flu. But she's not getting better, and I'm getting nervous, and she's not eating, and she's had this fever for so long." So we don't diagnose. Okay, I'd like to make that clear. We weren't trying to diagnose this child, but the mother asked us if we could test her up and see if there was any way we could help her.
Okay.
So we did our muscle testing, and what we found was that she responded really, really nicely, meaning she had some weakness, and when we introduced things that might help her, she responded really nicely to some antibacterial, herbal, and natural medicines. So I referred her back to the pediatrician, and I said, I think she may have an infection of some type. And lo and behold, she had a urinary tract infection, which was very, very uncommon for a child of her age. She had a rare genetic disorder where her bladder was positioned such that the urine refluxed back into it, and she was vulnerable to these infections. But we wouldn't have known to look there really without this muscle testing.
Another thing that you do when you're testing the muscles, you lay the supplements on the center part of the body, right over the belly button. And you put them, and you test the body. You test the body to see, first, if it wants it. If it wants it or if it doesn't. If it doesn't want it, you put it back on the rack. And if it does want it, then you could tell how much the body wants. The body tells you what it needs, which just blows my mind because it's an exact science, and the body's not going to lie to you. This is what just perplexes me. How is my body or someone else's body telling you what we need? What does the belly button have to do with you? I mean, is that like the center core?
Well, there are many areas in the body that have lots of energy sensitivity. And they're known as chakras in some field, or energy centers. The belly button is one. There are 7 main ones, but we use the belly button because it's convenient. It's not belly button actually, but abdominal area.
Okay.
And by now the audience is saying this is total voodoo because we're placing bottles on and we're testing muscles. But in fact, what we're really doing is assessing areas of imbalance and what's creating a change in the neurological and muscular system. And we use glass bottles because, in fact, energy will travel through a glass bottle.
I always wondered about that. Okay, that's great.
Yeah.
Okay, so so we picked out 4 specific problems to discuss today. Let's start out hearing from one of your patients what your patient has to say about asthma. This is awesome.
was 1 year old. He's now 5. And just over a year ago, I came across with Ann, and she told me that she has treated asthma successfully. Before coming to Ann's office, Antonio was on a daily treatment of corticosteroids, and that made me very uncomfortable and unhappy, but at the time I felt that I had to do it to keep his asthma controlled. And even though I didn't really like the idea of having him going through these steroids on a daily basis. So we started working with Ann, first with Antonio on controlling his asthma with a number of different treatments. And immediately within 4-6 weeks, I started looking at the changes and how good he was doing in controlling his asthma. I phased out the medications that had been prescribed by the doctor and went full-blown with the treatment that Dr. Ann recommended. I'm very happy to say that over a year after we started the treatment, Antonio I consider him cured because his asthma is fully controlled, 100% controlled.
Dr. Ann, it's pretty impressive stuff that Vanessa. Tell us more about asthma, please.
This was a real exciting thing for us because, again, it doesn't matter to us per se whether you have asthma or low back pain or headaches or allergies, because we're not trying to diagnose a symptom. What we're trying to look for is in areas of imbalance in the body that we can support nutritionally. And we look for stressors on the nerve system that once we remove them, the body can just kick in and do amazing things all on its own. And this particular child happened to go to school with my son. And when my husband was speaking to the mom at a party, he said, "Oh, you really need to bring Antonio into my wife. I think that she could help him." So we did, and it's very, very gratifying to us because prior to our assessing and helping this child, he was taking, as you heard, corticosteroids daily, which is not without effect on the liver. And what we discovered is that eliminating some dairy foods from his diet and supporting his body to get rid of metals, particularly mercury, and with a very diligent mom who followed the recommendations to the T, never complained about trying to get supplements into her child, just totally overjoyed that there was an alternative for him to these medicines that, he did in fact need. And from the day we saw him, from the first day we saw him, he's never taken another medicine. So we used this system called nutrition response testing. We checked his nervous system. We found some stress on the nervous system, nutritionally based. We also adjusted this child with chiropractic, so it's a wonderful combination, taking pressure off the nerve system, taking pressure off the physiology, and his body was able to heal up.
Well, a good friend of mine, Dr. Andy Kulik, told me about you and your practice, and I have to tell you, I was a little skeptical until I started working with you. And for people who do not understand the practice, I think that you are one of the finest doctors that I've ever met in the world, because you help to keep the body in balance in a way that you're very nurturing, you're realistic about your approach, and you give the people what they need. And you spend time, you talk to the patient, and it's you're very impressive. And I'm thrilled that I am seeing you. I feel very healthy. I feel by coming to see you, I'm keeping myself on a maintenance schedule, and I can remain healthy. And my health, to me, is the number one thing on this entire planet, because if I'm healthy, then I can do anything. When you have your health, you have your wealth. So thank you.
It's been my pleasure.
Thank you.
All of my patients were that enthusiastic.
Well, I think all your patients are quite impressive. Now, you talked about Antonio. Was he doing a lot of dairy? Did that Did that have something to do with his asthma, or did that just make his asthma worse?
We do find that dairy foods can contribute to chronic recurrent upper respiratory type syndromes in children. That is our experience. Things like ear infections, chronic recurrent, things like even remotely, things like eczema and rashes that don't go away. A lot of times you remove the offensive food. And it's part of the problem is that we process our dairy products. You're not milking your cow and coming in with raw milk and drinking it.
With milky, okay.
Okay, you're
Right.
homogenizing and pasteurizing and all of these techniques that we've had to put in place because we've commercialized food. So it has to travel in the truck and get to the store, and you have to do something to prevent the growth of bacteria and the spread of disease through the commercialization and shelf-lifing of food. But in part of this processing now, we've created other problems, and dairy products are one of those that we explore. Now, not everybody has trouble with them, but if you do and you remove them, and it's a great test to any of the viewers if you have any health issues, remove the dairy products for 21 days for children, probably 60 to 90 for adults, and see how much better you feel.
Oh, it's just unbelievable. I know that you recently told me about rice milk. I love rice milk. It's fantastic. As a matter of fact, you told my mother about rice milk, and you gave Mom a book about milk and, you know, what milk can do to you, you know, the pros and the cons, and she's read through it. And she's very impressed. Our next patient has an arthritis problem, and she comes to you. You help her with chiropractic adjustments, and I guess, well, let's see what she has to say, and then we'll talk about Denise.
Hi, my name is Denise, and I am a patient of Dr. Ann Doggett. I've been coming here for approximately maybe 12 years. And I have started with Ann because I injured myself, my back and my leg. Don't know how. I ended up waking up the next morning being paralyzed, hunched over. And my next door neighbor, who also comes to Dr. Ann, suggested for me to come here. So I had to come here by cab, and my very first treatment was she was able, I was all hunched over, maybe able to sit straight up. And I've been coming ever since. I had treatments every week, and then it goes to like once a month. And I do go for the maintenance, which is very important.
Well, you have another patient that believes in you, as they all do. So how long, when Denise came to you and she was getting chiropractic care, how long does the adjustment hold? Does the muscle have memory? Am I asking a question that has to do with being a chiropractor?
Yes, you are. And the length of time an adjustment holds is dependent upon so many factors. Part of the reason we got into nutrition is that if the nutrition health is there, if you have the right minerals, for instance, to support your ligaments, then in fact you can hold adjustments a lot longer. If, you know, coffee is stressing the body, or sugar, or white flour, or hydrogenated oils, or any of those things are present in the diet, you may not hold your adjustment quite as long. And yes, muscles do have memory. So typically in the initial stages of adjusting somebody or caring for somebody's spine, we see them a little more frequently as we re-educate the muscles to the new position and new function.
Okay. I don't know what else to ask you about this, but all right, because I know that you have a lot of patients that come in for chiropractic care, like someone gets into a car accident. Should they come and see a chiropractor if they just have like a neck jar? Is it better to take care of a problem immediately than wait because it settles in?
Yeah, absolutely. And it actually bothers me when we occasionally hear from a patient that their medical doctor has told them not to come in, you know, for some reason. Perhaps they don't fully understand what it is that we do. But in fact, the physical stress of an accident is one of the initiating factors of spinal problems. So, and there have been studies that have been done on the spine for people who get chiropractic care as opposed to those who don't. And you will see degeneration that progresses on a spinal level in those people who do not seek chiropractic care. So that's the person that may have had a little fender bender and their neck went forward and back and they had a little discomfort, but it only lasted a few days, so they thought they were fine. And then we see them, 5 or 10 years later, and we take an x-ray and there's degenerative arthritis. So the physical stress in little ones when they're learning to walk and they fall, on their bottom, that's a physical stress to the spine. Adults, we can have what we call macro trauma, things like car accidents, slips and falls, or we can have micro trauma. You talk on the phone, you hold the baby on one side, you carry your bag on one side, you cross your legs at the knee. These are all micro stressors or micro traumas that can occur on a daily basis, a number of times, and they can accumulate over time and really create stress.
When I was a little kid growing up, I remember my neck used to ping. I used to hear like a ping, and I'm saying, what is that? But then I started seeing a chiropractor at a fairly early age, and I don't get that anymore. And so I guess the question is, if a person has a trauma and they get along in years, can you reverse or bring it back to its original state or a state of balance?
I would venture to say we can bring you back to a state of balance. The reversal process is dependent, again, on many different factors. And yes, age is a piece of that. Nutrition is also a piece. And we know that the cells of the body regenerate every 7 years. So I'd like to believe with the good, proper nutrition and replacement parts, people can, in fact, reverse damage and degeneration. But it is dependent. It's not a simple answer. There are lots of different factors that play a role.
We have all night. Do you recommend that the average person come in as a routine maintenance check to a chiropractor? Is that a good practice for people to do, even if there's nothing wrong with them, just to keep their body in tune and lined up? Like we go to the dentist and we get our teeth cleaned. Is that something that you...
Well, if you look closely at how important the spine is, I mean, it is the main protector of the nervous system. And every single organ in your body gets a nerve supply. That's your heart, your lungs, your liver, your kidney, gallbladder, stomach, intestines, reproductive. Every organ gets a nerve supply. And the access that the body has through the nerves is through the spine. So anytime you have spinal misalignment, you can have pressure on a nerve. And the very Western approach to health is when you have a diagnosis, you do something about it.
Right.
Our approach is, let's get you before the diagnosis, when the body's function is actually declining before you actually have the sickness and disease. And there isn't anybody that checks your spine. We do go to the dentist regularly. We do see our doctor regularly. And who's checking the spine to really determine are there misalignments?
And the spine's probably the most important part of the whole body because it holds it all together.
It
like
protects
glue.
your nervous system, that's for sure. It's a protector of the nervous system. So from that perspective alone, it's important. And I believe, my children get checked regularly, and my nieces and nephews have been checked since birth for, spinal misalignments, even in the absence of symptoms.
When you say your children get checked on a regular basis, how often is that? Is that once a week?
Generally speaking, once a month is a good amount of time.
Okay.
If you're watching your kids, you'll know if they've sustained some type of trauma. You might want to get them in faster. If you notice any symptom at all in your child, which is anything from a runny nose to a cough to an irritable mood, it's a good indicator that something's out of balance in that child. And I would say the sooner you get checked, the better. And
you know how kids play a lot of sports today, or even adults, they're playing football and they're getting banged up on the field. Isn't that really tough on the body? Doesn't that just throw everything out of whack?
If you're in a sport, I would suggest coming in weekly for most of these kids, actually. And yes, the physical stress is intense.
Okay. I think the next thing we're going to talk about, which is a pretty huge subject, is fatigue. And everybody's walking around today like zombies. They're tired. And I don't know if it's because they're not getting enough sleep, if they're eating the wrong foods. But everyone's complaining about this. So let's see what Linda Del Greco has to say about fatigue.
Hi, my name is Linda Del Greco, and I've been seeing Ann since the summertime. And I came in with experiencing very bad fatigue, bloating, and I've had chronic vaginitis and yeast infections for about 4 years. The infections, I did not have any recurrence of the infections after seeing Ann and being treated in 2 weeks. The bloating has since minimized, and my energy is much better.
Well, Linda had some great things to say about fatigue and the great stuff, the great work that you're doing with her. Tell us about your work with her and some of your cases that you've worked with. This is a huge, huge problem in the world.
It's probably the #1 complaint that we see. And fatigue can come from a whole variety of reasons.
I have all night.
So we spoke earlier about the adrenal glands, those stress handling glands and the hormones that are put out there, and how tired those glands can get from chronic not enough sleep, for instance, can put a lot of extra work on those glands. Too much coffee can put a lot of extra work on those glands.
So the very thing you think that keeps you up will pull you down.
It gives you a temporary increase in energy, but ultimately it's going to deplete those glands that are important for your energy production. The thyroid gland is also very important for energy production, and we see a lot of really tired thyroids, and that can come from the fact that we chlorinate our water, and thyroids can become affected by that. We also don't use, the majority of people, a good healthy salt with C minerals, including iodine, which is important for the thyroid. Sea vegetables, for instance. We know that the Asian cultures have less breast cancer than we have in our culture, and one of the reasons that scientists speculate, and they have actually data to support this, is the consumption of sea vegetables and the iodine in the vegetables, and how important that is for your thyroid gland, which in addition to energy is important for immune system function. So what we did with this particular individual is what we do with everybody who comes to our practice, is we assess their body, we find areas of interference, nutritional imbalance, we support the imbalance, and the body can heal up.
You talk about sea vegetables and the thyroid. Are you saying that if we eat certain kinds of vegetables, that it will increase our energy?
If we changed our diet to include more vegetables and less processed foods in general, that is helpful. And in fact, if you have a thyroid that is a little sluggish, you know, you've been to your medical doctor, you felt like you had a thyroid problem, but they didn't find anything, you tested normal on blood work.
Right.
You can still have a thyroid that's a little sluggish. And we actually do screenings. I think an earlier question that you had for me is, aside from the muscle testing, what other tests do you do? Well, we do blood pressure, and we do blood pressure in 2 different positions. And in fact, if your blood pressure doesn't rise when you stand up, then your stress handling glands are tired. That's one of the assessment tools.
That's right, I forgot about that test. That's a good test.
We also do what's called an iodine patch test, where you can actually paint on your skin a little patch of iodine, like the stuff you buy at the drugstore that you use. And you watch how quickly it fades in the skin. And if it fades away very quickly, you're deficient in iodine. And just supporting that one mineral to support the very important thyroid gland in the body can affect your energy levels.
Does water have anything to do with us being tired, people not drinking enough water?
Water can in many ways, because yes, I don't know the exact statistic, but the majority of Americans are in fact dehydrated. Because we're not drinking water, we're drinking coffee and soda. And when I tell people they need to eliminate or suggest that they work on eliminating either coffee or soda, they'll say, you know, what am I going to drink? What else is there?
What are they going to drink?
Well, water's a good start, especially since we're all dehydrated, and that is really the best beverage. Green tea is also a fairly decent alternative.
Does green tea have caffeine?
It does have some caffeine in it, and if you get organic, you will eliminate any pesticide issue, and you can get some benefit from a good quality green tea in terms of decreasing potential for infections in the intestine and increasing what are called antioxidants, the nutrients that help defend the body against chronic stressors or free radicals, which are damaging compounds that are produced by the body.
Getting back to the water, should a person take showers with a filter? Does that affect what goes into the body, or does that make any difference?
It does, and you can absorb, I think as a 2-minute shower, you can have the equivalent of drinking 40 glasses of chlorinated water.
Say that again. A 2-minute shower is equivalent to drinking 40 glasses of chlorinated water?
In terms of how much chlorine you potentially absorb in the vapors of the shower, hot shower. Yes, showers
oh my
are.
Goodness. So does that affect your fatigue level?
It may. And again, the beauty of this technique is to look at the individual and say, what is going on in this individual? And if this individual shows a thyroid weakness, and in fact they show chemical toxicity on the thyroid, such as chlorine, then that individual is in fact going to be advised by our office to look at getting a filter for their shower. And that's kind of how we work. Look at the individual, find the problem with the individual, and then work to help them find some solutions.
So every single person is different.
Absolutely.
And no two people have the same problems. You've been helping my mom. My mom's been having problems with her knee and her lower back. And she's starting to see some really good improvements. My mother's going to be 84 years old, and she's moving up and down the steps. I hear her going, because I live in the first floor, she lives in the second, and I hear her moving a little quicker. As a matter of fact, I caught her running down the street the other day. I mean, she was running. I just said, where you going?
Were you chasing her?
Well, she was running to church. And she didn't realize that she was moving quickly. And I haven't seen her move. I forgot to tell you that, which is awesome. I went, and she didn't realize she was moving quick, but she's like getting her fast movements back because of what you're giving her. As a matter of fact, we have some supplements here on the table, and you work with this company called Standard Process.
Yes.
And Standard Process is out of Wisconsin.
Yes.
And they have 230?
380 acres of organic farms. And, you know, this company's been around for over 75 years.
75 years?
Yes, and they started, it was founded by a dentist, Dr. Royal Lee, who initially explored the relationship of diet with dental health. And what he found 75 years ago continues to be proven with scientific research and data to date. What we love about their products is they actually use whole foods. So if you need vitamin A, for instance,
Right.
which is found in carrots,
Okay.
what this company does is they harvest organic carrots like nothing you've ever seen in the supermarkets here. It's actually a big, fat, round, healthy vegetable. And then they juice them and vacuum dry so that there's no heat applied in the process. So you keep the enzymes in the food that is important to actually use the nutrition in the food. So you get literally a whole food-based supplement. You don't get a piece of the food. You don't get beta-carotene, which is a synthetic precursor to vitamin A.
right.
Okay, so very, very different. We also love their herbal medicines because they are regulated by the government. They get imported from Australia.
They are regulated by the
They're
government.
government regulated in Australia. In Australia, they have a much higher regulation intensity for herbal medicines. For instance, one of the common herbs that you'll hear about is echinacea. And you don't know as an herbal supplier in the United States if the person is the herb from China is coming to you is the root of the plant, of the flowering top of the plant, or if it was grown next to a copper pipe, or if it had pesticide sprayed on it, or
Right.
what was going on with that particular herb.
Right.
In Australia, they have to actually test for impurities. They have to look at, you know, are the active components in the herb when they receive it and then after they process it. So you really, quality is a very, very big issue in herbal medicine. I know for years I did what I thought was the right thing with patients and got marginal results until I started using good quality herbal medicines. And so we use the company's called MediHerb, but they're distributed through Standard Process
Right.
in this country. And it's a whole herb, just like a whole food. Very, very important. Quality will affect results.
What I really like about these vitamins is they're very light and airy. Sometimes you take a supplement and it feels so heavy and it sticks to you. Now, I don't know why these are light and airy, because I remember telling my mother, I said, Ida, these are really light. They don't, do you know what I'm talking about?
Well, it's whole food. It's like eating the food. So, you know, to get vitamin E, they actually have wheat germ that they'll harvest. To get vitamin C, what you find in most vitamin C supplements is ascorbic acid, which is just a portion of the full vitamin C complex. So if you were to go into a CVS or a GNC, or the majority of the vitamin C products, if you were to read your label, would say ascorbic acid. This company will use pea vines, which is a source of vitamin C, or buckwheat, which is a source of vitamin C, and they will actually get the food and vacuum dry it and you know, juice it first and then vacuum dry it. So you will get the full complex. It's like sitting down and having the whole food, which we really don't have a lot of in this country at this time.
So if people had the right supplements put into their body, if they were tested by someone like you, or if they were tested by you, their whole body would stay in balance.
That's the idea, is to supply the body with what it needs, to remove the toxins from the body as much as we can through diet and environment. And then the body can do amazing things, as you've heard from the 3 individuals so far.
Should a person get out as much as they can in the wintertime to breathe in the oxygen? Oxygen is so good, and I think we do get a lot of oxygen from these foods too, don't we? Because, am I correct to say that?
When you supply the body with the correct nutrition, then you can make red blood cells, which in fact deliver oxygen to the tissue.
Right.
So perhaps it's better oxygen delivery to the tissue because of healthier blood and other systems in the body. And should we get out in winter, there's all kinds of benefits to moving the body. Increasing oxygen is one of them. Lymphatic drainage is another, because as you move your muscles, you will stimulate the lymphatic system, which is part of the immune system. So it'll help you move toxins right through and out of the body.
Excellent. Okay, well, we have another patient that we're going to talk about, and her name is Kim. And Kim came in to your office, and she's had one of the most satisfying results. So let's hear what Kim has to say about infertility.
My name is Kim Lanigan. I've been a patient of Dr. Ann's for nearly 2 years. I originally started coming to see her because I have PCOS, which is polycystic ovarian syndrome, and they had told me from the time of teenage years that I could never have children on my own, and was referred to Dr. Ann by a friend of mine, and about 4 months into it, I found myself pregnant. So we've been coming ever since, and this is Carson, my son, and now he's also a patient of Dr. Ann's, wellness patient. Why Dr. Ann thinks I may have been having all the problems with conceiving or getting normal periods or cycles was due to the fact that I was born with a cleft lip. So she treated my scars, which kind of neutralized my entire body. And that was, we're not sure if that's actually what did the trick, but it sure did help. You can just barely see my scars today. I've probably recommended about 7 or 8 people, at least 7 or 8. One of my girlfriends had been trying to conceive for about a year and a half, and she is very proud to say she's 12 weeks pregnant as well. So very healthy pregnancy so far.
Kim was fantastic. She was explaining, of course, how you were able to go right to, I guess she had a scar, and that had something to do with...
Well, this was an interesting case because there was a lot of different pieces to it.
Right.
She had a very rare genetic, well, not so rare now, but a genetic disorder called polycystic ovarian syndrome. Part of that syndrome for women is infertility. She was told from the time that was diagnosed as a teenager, as you heard, that she would not have a child. She came to us because one of her friends had been to us for rheumatoid arthritis, and her friend was able to get off of all medicines for rheumatoid arthritis and was wearing high heels and out of pain and, you know, feeling great. So she wondered if we could help her. We did our system as we always do, which is to assess the body and find any areas of interference factors, support the body with nutritional supplements and or herbal medicines, natural therapies, and then give it a chance to heal. And the most interesting part of this is that one of her parameters for measuring if we were helping her was she was waiting to get a menstrual cycle because she hadn't had one. So 3 months had come and gone and she didn't get a menstrual cycle. So she thought, well, you know, I feel better than when I came in here, but I'm not pregnant and I'm not going to get pregnant. And I'm really busy at work and I'm traveling, and we tried to reach her for several months. Right. And as it turned out, she was pregnant after her 3rd month of care. And
That's amazing.
yeah, it was amazing, and you got to see the beautiful baby boy there.
Yeah, he's cute.
Yeah, and he's just very pleasant. And because of the education that we gave her in the first 3 months of her care, she had shifted her diet dramatically. She ate healthily through the whole pregnancy, even though she was not aware she was pregnant. She did have a scar. She had cleft palate surgery when she was an infant. And oftentimes people will say to us, you know, but I got that scar when I was a kid. How can that be, you know, playing out? Or I'm 70 years old and I had that C-section when I was 28. How can that be playing out in the body?
Right.
But in fact, the body will tell us if a particular scar is creating nerve interference. And when we see that, we have to correct it. And we haven't spoken about what we do to correct it.
Well, I think we should then.
So there are a
What
couple
do
of
we
things.
do to correct it?
The remedies are really fascinating. 50% of the time, all you have to do is supply the body with a good, healthy source of vitamin E.
Wheat germ oil.
Comes from wheat germ. So that, in about 50% of the cases, is what we suggest, a good quality wheat germ oil. And ours comes in the little capsules, and they puncture it and they rub it across the scar. And the phytonutrients, so the nutrients from the plant, with the vitamin E, can create repair in the tissue and in the nerves. So that was a piece, and what she found fun is that her co-workers were coming up and asking her, are you wearing a different foundation? We can't see your scar. So it's not that we do this for cosmetic reasons, but that's just a wonderful
So this
side
is a
benefit.
simple little, it's almost like it's magic. It's not a trick.
It's very easy. Once you identify what the problem is and what the solution is for that person, amazing how simple the solutions can be and how dramatic the changes can be in this person's life.
Well, I'll tell you, she's blown away with you. You help her to produce this bundle of joy. That's awesome.
Yeah, we're working on the second baby now. She's ready for this first one was so wonderful. She thinks they're all going to be that way.
And you were talking about diet, because diet, not only for pregnant women, but diet in general for people. I know that when people are tested with you, you come up with a lot of different people have allergies to food, and sometimes the very thing that they're allergic to is the very thing that can cause an adverse reaction, maybe weight gain, bloating.
Well, allergy technically is not what we find. Allergy is a response that's mediated in the body by a certain part of the immune system that can create things like constriction of the vessels to the lungs, for instance. We think of allergy as something that's going to give you hives and itching eyes and a closing throat and a swollen tongue and all of that. But there are sensitivity reactions to foods that are not full-blown allergies. They, in fact, are sensitivities. And those are the ones that are troublesome because you're not aware that they're causing you problems until you remove the food for a period of time and then reintroduce it. So they call that elimination provocation. You know, you take the food out for 90 days. And
90 days? Not even a week?
Well,
90 days.
it depends. For adults, 90 days is a good amount of time to really let the body clear the potential negative effects of the food, particularly wheat and dairy.
Now, does wheat can also create a lot of symptoms like dairy, gluten. Am I correct to say that?
We do find that in our practice quite often. There are full-blown medical diagnoses around intolerance to wheat and dairy called celiac sprue. There are, in my opinion, in my experience, a number of people who walk around with sensitivities to these foods that can be contributing particularly to joint pain, but to a number of other health issues in the body.
Okay. Well, we have a couple of minutes left, and I just want you to share with your audience some things that you'd like to leave them with, because you have so many great things to say, and we can go on all night because it's endless. So would you like to leave the audience with anything right now?
Well, one thing that makes food choices really simple and easy is if you can pick foods and eat them the way they are designed in nature before they're processed, things like vegetables and fruits. And if you think about the evolution of man, we were hunters and gatherers, so the bodies function very well for the most part with things like fish and chicken and turkey and vegetables and fruits. The more you can avoid the processed foods, the better. Things like white flour or white sugar, especially hydrogenated fats. And I think we could do a whole show on fat and good fats and unhealthy fats.
What is a good fat?
A good fat would come from something like a nut or a seed or fish. They are the omega-3 classification of fats. They're the ones that are in fact not only good but essential for health in the body. Without them we become sick and diseased. And we get them from our things like cold water fish, Alaskan salmon, trout, halibut, things like almonds and walnuts and seeds. So,
well, Dr. Ann, you have been such a delight. Thank you so much for coming to Somerville, Massachusetts, and sharing with us your wealth of knowledge. And we love having you here. We hope you come back again. And thank you for helping to keep all of us in balance. Our bodies are forever grateful.
my pleasure being here. Thank you for having me.